Hi, my name is Amanda Ojeriga, a second year Masters in Public Health student. This study was put together by myself and Edmore, a second year MPH student as well. The study was to determine the risk factors for COVID-19 infection in a population of MSU campus students not seeking clinical care at the campus clinic. COVID-19 is an infectious disease caused by the newly discovered coronavirus called SARS-CoV-2, and the primary mode of transmission is through droplets of saliva and from the nose of an infected person when he or she coughs or sneezes. The MSU COVID-19 monitoring team has been conducting PCR, which is known as polymerase chain reaction based test on COVID-19 testing on campus on a weekly basis. And the reason for this testing was to gauge the number of asymptomatic infections here on campus. So from August 2020 until December of 2020, the monitoring team tested over 1,400 students with 27 reported positive cases. This project is done to investigate the variables predictive of COVID-19 infection in that population of students. The data for this study was collected through convenience sampling. We had volunteer students who were on campus complete a questionnaire on various demographic and housing information, and they were provided with a PCR-based test of COVID-19 infection. The result of the test was provided to the volunteers and to the monitoring team, and from there we conducted this analysis. Figure 1 and 2 shows the results of the demographic information collected during the convenience sampling. And I have to say that our convenience sampling strongly represented the actual population of MSU students, but we did tend to undersample the non-traditional students, and that is primarily because our data was collected during the daytime, and non-traditional students like the postgraduate or master students tend to be on campus around the evening time. In the age category of figure 1, age category is 25 to 39, 40 to 59 clearly shows the undersampling. Table 1 shows the housing arrangement as a risk factor for COVID-19 infection, and at a 95% confidence interval, none of those housing situations was significant of risk of COVID-19. At a 90% confidence interval, living in a fraternity or sorority house and those living in an apartment with roommates was approaching significance. And what this means that if this test was conducted 100 times, 90% of the time, those living in a sorority house and those living in apartments will still be approaching significance. Table 2 is where our results gets really interesting. In Table 2, the results of the study showed that only loss of taste and smell was significant. That means loss of taste and smell is most predictive of COVID infection. Individuals who reported loss of taste and smell were 17 times as likely to test positive for COVID compared to individuals who did not report loss of taste and smell. Other reported symptoms like diarrhea, fatigue, headaches, and those other reported symptoms were less predictive of COVID infection. Having any symptom did approach significance, but that will probably be due to the sampling of the loss of taste and smell. So our recommendation is that, given that the only symptom that was truly predictive of COVID-19 was individuals who reported loss of taste and smell, we recommend that those individuals or students and who identify these symptoms in themselves seek clinical care and get tested for COVID. We also encourage the general continued compliance to COVID-19 guidelines and targeted surveillance measures, especially for individuals living in a fraternity or sorority, as the risk of contracting COVID was approaching significance in that population. We would like to thank the MSU COVID-19 monitoring team for giving us the data for this analysis. We would like to thank David Hall, who is the Director of University Safety here at MSU, Andrew Inklet, the Associate Director of University Safety, and lastly, we would like to thank Karen McGuinness, the Manager of Emergency Preparedness here at the MSU campus. Thank you.